Howdy folks, Darren Ray Fonso here talking about workers' compensation or labor and industries as we call it here in the state of Washington. Today I'm talking about how I've tried to turn in SeaMar healthcare centers for failing to represent the harm done to me as an injured worker and my mental health and 400 injured farm workers in our state that are crying out for help. And their failure to report that abuse on Latino Legislative Day is they were bragging about being able to get our voices heard by our lawmakers and talking about mental health and how workers' comp affects Latinos in Washington state. Yet nobody wanted to talk about the harm done to us. And so I'm trying to get this abuse reported. And so I'm trying to turn them into this North Sound Ombuds person. They're supposed to be the North Sound mental health ombuds people. These are the ombuds people who are supposed to help me if I'm being harmed or hurt in my care. So anyways, they've already told me that they're not going to help me, but I want to get it documented here for people to see how they treat us injured workers. You
have reached the North Sound Behavioral Health Ombuds. If you are in crisis and need to speak to a crisis professional, call the crisis line at 1-800-584-3578. Ombuds staff assist individuals who have questions and concerns regarding the behavioral health system. If you have a question or concern you wish to discuss, please leave your name, phone number, including area code, and a short message. Ombuds services are free and confidential. All staff are happy to assist. Press 1 for Boone, 2 for Caitlin, and 0 for Kayla. Please hold while your call is being transferred to Kayla Buchanan. You've reached Kayla, Ombuds support staff. After the tone, please record your message. When finished, you may hang up to deliver the message or press pound for more options.
Yes, my name is Darren Ray Fonso, the angry injured worker who's been trying to contact you and get your help. I talked to one of you on the telephone. I don't know if it was Caitlin or Kayla. I've left a message with your boss as well, who I know is gone for a week. I feel like you are failing my injured workers and myself and people with mental health issues in the state of Washington. I myself, as a mental health patient, feel what was done to me by SeaMar and the betrayal and legislative Latino Day was harmful to my mental health. And so when you tell me you don't see how this relates to my mental health, I think you are very off base, young lady. And if you can't realize how much this harms my health even more so than it was already harmed, this is adding insult to injury. When I try to report abuse on SeaMar doesn't want to report that abuse to harm to humans on Latino Legislative Day. I try to turn in our lawmakers. I try to report this to the state ombuds mental health person in my county here, who's supposed to be helping me, but seems to be yet just nothing but a block. You're a block like the Snohomish Human Rights Council is a block. You all are in bed with entrenched Democrats, and none of you want the truth to get told about a war on injured workers or how LNI is failing some of us and harming our mental health. And so when I reach out to the state ombuds person to get my issue addressed and the harm to me addressed that SeaMar is doing and their failure to report abuse and the codified abuse and patient abuse and codified oppression that you apparently don't want to address as my state ombuds person. I feel you are failing me, and I want to not talk to your boss, and so I'm going to continue getting a hold of you until I get a hold of your boss next week to find out why it is you are intently failing to want to represent a mental health patient in the state of Washington crying out for your help, telling you his mental health team has failed him intently to spin the narrative to say we're not harming injured workers and their mental health in the state of Washington, when in my case, Bruce, we have. I want this addressed, and I want you to talk about it. And I'm going to make sure I'm making a video of this call right now, and I'm sharing it with the nation. How my state ombuds person at the North, whatever you guys are, North County mental health ombuds person does not want to step up and talk about the abuse and oppression and harm and the mental health harm that LNI has created in my care and maybe even to some of those 400 injured workers' care. At least tell about mine. Tell the truth about it. Don't sit around and spin it and say, oh, nothing's wrong here. Because that's what our state Democrats say, nothing's wrong, but the feds say stuff is broken and injured workers are being harmed, but state lawmakers say, no, everything's fine, and it seems like all our mental health people and all our medical professionals are all in bed with entrenched Democrats, and nobody wants to tell us the truth, and they're all in bed with business community instead of stepping up and representing the injured workers and the patients with mental health conditions in our state. Besides that, Latinos, which 50% of them fatalities on the job fatalities last year were Latinos. So this is egregious. When the state ombuds person won't step up and help me fight for my rights and all the 400 injured farm workers' rights and anybody else with mental health conditions induced by a bad, broken state work comp system, then nobody seems to want to step up and address or admit that it's broken. No state lawmaker seems to want to admit it's broken, or if they do, they want to use it to push for Medicare for all, which will be, many people may get cost shifted off to. That's another issue. I want to thank you for listening to my call, and like I said, this is live online, so you may want to Google me, and I suggest you do, because what you guys are some really snobs. Is what you are. It's intellectual freaking snobs, and that's the problem with this dim party and all this medical community. You're all like dim snobs that become like Nazis that want to tell everybody else what to do and don't want to abide by our rights and our human rights. My human rights are being violated. Other patients' rights and human rights are being violated. Those 400 injured workers' human rights are being violated. And when the Snohomish Human Rights Council won't step up and address that because all of Senator Marilyn Chase's friends and family are entrenched in that and they are blocks to the truth getting out, then this is a community that doesn't want to tell the truth about a war on injured workers. And when this state ombudsman, North County ombuds person, can't step up and help me fight SeaMar and get this issue addressed, and I'm not after money. What I want is an institution that says it's there for Latinos, says it's there for injured workers, says it's there for people's mental health, to actually do that and represent it and report abuse to patients for profit. And that's exactly what this is happening in the state. And when SeaMar can't report abuse, and they fail to do so, and then the state ombudsman then steps in and says, yeah, nothing's wrong here, everything's cool, maybe I should refer you to a lawyer, is what she said. No, yeah. I am my lawyer, and you're going to be hearing from me. Have a good day.
For the maximum time permitted. To replay, press 1. To erase and re-record, press 3. For special delivery options, press 9. To send this message now, press pound. Message delivered. To leave a message, please enter a mailbox.
So there you go. There you have it, folks. I've left them messages, I've sent them faxes, and I did speak to a lady on the phone today. Her name was Caitlin or Kayla. I don't know if she's just a front office staff help, or she seems to act like she has the authority to say that, no, this hasn't affected your therapy. This has nothing to do with your mental health therapy. God damn, that pisses me off like a motherfucker. If she don't think this has anything to do with my fucking mental health being the state that it is, she is totally wrong. You state ombuds person are failing in your duties to represent me as a patient in that state, and I want your job. Have a good day. And I'm going to get that job, young lady, because you have no business doing it if you can't step up and represent patients with mental health conditions crying for your fucking help. Have a good day.